HIV, human immunodeficiency virus, is a virus that attacks and weakens the immune system, making the infected person vulnerable to various infections and diseases. HIV can lead to acquired immunodeficiency syndrome, AIDS, a condition in which the immune system is severely compromised, making it difficult for the body to fight off infections and diseases. While there is currently no cure for HIV, antiretroviral therapy, ART, is available to manage the virus and prevent progression to AIDS. How HIV transmitted? HIV, human immunodeficiency virus, is primarily transmitted through the following ways. Unprotected sexual contact. HIV can be transmitted through vaginal, anal, or oral sex with an infected person. The virus can enter the body through small tears or cuts in the genital or anal area, or through mucous membranes in the mouth or throat. Sharing of needles/syringes. HIV can be transmitted through the sharing of needles/syringes with an infected person, particularly among people who inject drugs. Mother-to-child transmission. HIV can be transmitted from an infected mother to her baby during pregnancy, childbirth, or breastfeeding. Blood transfusion or organ transplantation. HIV can be transmitted through blood transfusion or organ transplantation from an infected donor, although this is rare in countries where blood and organ donations are screened for HIV. Occupational exposure. Healthcare workers and other first responders may be at risk of HIV transmission if they come into contact with blood or other bodily fluids of an infected person, particularly if they have an open wound or needle stick injury. It's important to note that HIV is not transmitted through casual contact, such as hugging, shaking hands, or sharing utensils or food. How HIV can be avoided? HIV, human immunodeficiency virus, can be avoided through the following measures. Practice safe sex. Use condoms consistently and correctly during sexual intercourse to reduce the risk of HIV transmission. This is particularly important when having sex with a new partner, or if either partner's HIV status is unknown. Avoid sharing needles/syringes. If you use drugs, do not share needles/syringes with others, as this is a common way for HIV to be transmitted. Get tested. If you are sexually active or have shared needles/syringes, get tested for HIV regularly. Early diagnosis and treatment can help prevent the spread of the virus to others. Get treatment. If you are HIV positive, get medical care and follow your treatment plan to reduce the risk of transmission. HIV treatment involves antiretroviral therapy, ART, which can suppress the virus and prevent progression to AIDS. Pre-exposure prophylaxis, PrEP. Pre-exposure prophylaxis is a daily medication that can reduce the risk of HIV transmission for people at high risk of infection, such as those in a serodiscordant relationship or those who inject drugs. Post-exposure prophylaxis, PEP. Post-exposure prophylaxis is a medication that can be taken within 72 hours of a potential exposure to HIV, such as unprotected sex or sharing needles, to prevent infection. Practice good hygiene. Wash your hands regularly, and clean and disinfect any objects that come into contact with blood. Use caution with blood products. If you need a blood transfusion or organ transplant, ensure that it is from a tested and safe donor. Remember, HIV is a serious medical condition that requires medical attention. If you believe you may have been exposed to HIV, seek medical advice and testing as soon as possible. Thank you for watching the video. Please subscribe the channel and press the bell button icon for the latest updates. Keep visiting the channel, also share with friends and family. For any suggestion, please use the comment box.